Hey guys, it's Dr. Edwards at Sarasota Vascular. Welcome back to Whiteboard Wednesday. So if you're like me, every now and then you like to have a nice juicy cheeseburger. The problem with a nice juicy cheeseburger is it's full of cholesterol, which contributes to plaque formation. When we're born and when we're young, our blood vessels are nice smooth pipes. They're clean, blood flows through in a nice smooth straight fashion, what we call laminar flow, meaning it's like a smooth river. Whereas when we start to develop plaque, which mind you, is inevitable at some point in our lifetime, the byproducts of the things we're eating, the air we breathe, our genetics, contributes to these irregular plaques that form inside the vessel. It actually starts in the vessel wall, becomes damage to the innermost lining of the vessel, cholesterol starts to deposit in the wall, and then that plaque starts to grow. And over time, if we don't take steps to change our lifestyle, get our cholesterol under control, exercise, that plaque can grow. And as the plaque continues to grow, what can happen is the vessels can become completely blocked. This can happen any place in the body. It can happen in the heart vessels. It can happen in the carotid arteries in the neck. It can happen in the legs. And how that manifests depends on which vessels are affected. When we think about carotid artery stenosis, which is a risk factor for stroke, the cause of carotid artery stenosis most of the time, almost every time, is plaque formation. Plaque can be treated by placing a balloon inside and opening it up. Plaque can be treated by using a stent to open that up. And sometimes it's more appropriate to actually surgically remove the plaque and repair the vessel. And if we can't do those things, then the treatment is a bypass, where we might take a healthy vessel and sew it around the plaque to establish a new route for blood flow. So in summary, what's inside of a plaque is a variety of substances, including cholesterol and inflammatory cells, and sometimes even really dense calcium deposits. The treatments are really depending on which vessels are involved, which part of the body is involved, and who the patient is. The treatments are individualized. These include minimally invasive treatments like balloon angioplasty and stenting, sometimes surgical endarterectomy to remove the plaque, and sometimes bypass surgery to establish new routes for blood flow. The ways you can control and reduce your risk for plaque formation are eat a healthy diet, mostly plants. If your cholesterol is high, consider starting on a statin medication. Talk to your doctor or your vascular surgeon about steps that you can take to make sure your blood vessels are healthy. Thanks for tuning in.